There is a newly defined syndrome called Cardiovascular-Kidney-Metabolic Syndrome, or CKM. And this morning, our daytime cardiologist, Dr. Shoba, is here with important information about defining the stages of CKM and some treatment options as well. Good morning, Dr. Shoba.
Good morning.
We were talking off camera just a moment ago. CKM is a fairly new defining of the stages of it, but doctors have known about this for a long time.
Yes, this is just trying to put together a number of conditions that we know affect all our body parts at the same time.
Right.
And it has been what we've done on our previous shows long time ago, over the years. So you know, our heart,
yes,
the blood vessels in our body, kidneys, diabetes, and excess body fat in the wrong places. These are all linked together and tied together as a commonality, and so they have given it a new term, Cardiovascular-Kidney-Metabolic Syndrome. And what this does is it divides it into 4 stages, and it allows people and physicians alike to try to pinpoint, which stage you might be in, what diagnostic and treatment options you have, and can you regress backwards. So it gives you a number or a stage that helps you. Also, they're trying to define a new tool that not only takes into consideration these risk factors, but everything we have talked about before: stress, sleep, tobacco use, relationships, how you do at work, all these things that affect our body and our mind, and they're trying to develop a new tool down the road incorporating that as well.
Is it basically just stage 1, stage 2, stage 3, stage 4?
That is,
it breaks down according to that, or?
Yeah, stage 0. If you have no.
You're at stage 0.
Yes, you have no risk factors. You are really healthy. You're eating right. You're exercising right. You're doing everything right, and then next stage will become when you see a little bit of extra girth around your belly. And you are pre-diabetic. You don't hit the right numbers. You're not healthy, but you're not unhealthy yet.
Right.
So you're kind of in that borderline zone. You have to be really aggressive at this stage because you can regress backwards. Okay. Then you go into the next stage after that, where you already have defined blood pressure issues. You've been diagnosed with blood pressure, type 2 diabetes. You're actually obese. You've got some kidney issues. And then you go further forward. You're asymptomatic. You're still asymptomatic. You don't have symptoms, but all these risk factors are brewing in you.
Yes.
And then in the final stage, you already have end organ damage evidence, like you've already had a heart attack, you've already had a stroke, your kidneys are already trying to shut down. You've got all the, you've got heart rhythm problems. So you get into that stage. So if you're in the first few stages, you can actually regress backwards.
Right.
There are newer medications on the market that target all our body parts. They help the heart, they help congestive heart failure, they help our kidneys. And so is there a role for starting these newer medications a little early? Of course, cost is of concern.
Right.
And are there diabetes and weight loss medications that should be given earlier to some of these patients so that you don't progress forwards? Things like tools like calcium score, we have talked about it before, hardening of the heart arteries. Is that a diagnostic tool that we need to be using earlier on in some of these high-risk people? EKGs and ultrasounds of the heart, at what point do we order them? But ultimately, what boils down to each person taking charge of their own health, because ultimately you've got to eat right, you've got to exercise, you've got to take care of yourself. You just cannot rely on pills and tests.
And medical know-how is great, but knowing your own body and knowing what you need to do is even better.
Absolutely.
All right. Dr. Shoba, thank you so much for sharing that with important information, very important information. You can help stop the silent killer, CKM, other issues as well that we've talked about. You can find out more about all of this by going to heart.org.